welcome. Hopefully, this will be of interest to you. And again, with all of us going through what we're going through, at least this is one more outlet that you can listen to some folks and maybe get some information, some advice, some inspiration. And that's what we're going to try to do for today. So, having said that, I want to introduce our guest for today. She's making national news with us through Spectrum, has been on the circuit for a while, and she is an employee with us. Her name is Catherine Collins, and she is the business liaison for us. Uh, and so I want to introduce Catherine. Catherine, welcome to Airing Addiction,
Thanks
and
so much.
thanks for joining us today. And how are you dealing with all this wonderful stuff of being cooped up, especially in the rain and all of that?
Well, it's doing a number on me. I have my days. This being cooped up is one thing. Just not being able to live my normal life is starting to get to me after someone told me the other day it's almost 8 going into our 8th week. And I thought, that's why it's starting to get to me. So I'm hanging in there. Let's just say
Good.
that.
Good. I'm glad you are. And maybe this will be a little of a diversion for you, at least for an hour or so.
Exactly.
You know? And my biggest thing was, as we talked earlier a little bit, thinking that how can we help folks who are in recovery, in early recovery, and going through this right now? Because as we all know, recovery for anything, I don't care if it's substance use or anything, really relies on social support and social networking and all of that, but especially for folks who are recovering from substance use disorders and stuff like that. And now with this stay-at-home order, the social distancing practices, it's a tough thing, I would think, for folks.
Yeah, I was thinking a lot about that because as a woman in recovery, I'm not in new recovery, but I have been thinking about it. Like, had this been happening when I was new, I'm not sure it would have been as easy to. Obviously, it was the 90s, so it wouldn't obviously have been this easy to get connected virtually. But
Right.
I thought about it like, if I was new today, what would I want someone to do? Because back then, it's like you want someone to take you by the hand and take you to a meeting.
Right.
How do you get engaged into a community when you really know nothing? You really know nothing about what you're about to get into because you don't know what you don't know. And so I was thinking, people most likely don't know how to find the connection. Mm-hmm. So that I guess as a new person in recovery, whether you're coming through a program like ours where you leave the building with information about how to Zoom into meetings and a variety of different meetings.
Sure.
Either that or like, where would you go as a newcomer? And I think pretty much you could call any facility, ours, and say, hey, I'm new and I need help. I don't know how to get connected. And I think that would be the first step because it is so hard to, I don't know, it's so hard to feel connected.
Right. And I'm thinking along those same terms, meaning, mutual self-help, whether it's going to AA, NA, SMART, any of those options, relies on people interacting with each other, relies on people holding hands at times, whether it's a serenity prayer, relies on people hugging each other sometimes and looking at each other face to face, not 6 feet apart, and trying to support them. And now all of a sudden that was taken away.
Yeah.
So I'm wondering, okay, here we are, we're sort of tech savvy. I'm semi-tech savvy, so I'm sure you're probably better than I am. And I'm going, what if some older folks don't have the apparatus, let's say a laptop or an iPhone or something, and don't have the wherewithal? How do I get in through Zoom? How do I get in through something? I'm wondering, how are they faring right now? And so that's something that's in the top of my head right now.
You know what? That is a really good point. I mean, I do attend 12-step meetings myself a lot on Zoom. And I do see some of the older people with lots of long-term recovery who attend a bunch of meetings, which is why they're in long-term recovery. And I see them, and initially they were able to phone in. You can do phone in and listen. And I did a few things like reaching out to someone's adult daughter and saying, hey, maybe you could hook your parents up and help them figure it out, because it is a really daunting task when you're thinking about all the other things that go in with it as well. For example, it's one thing. Now we're in Zoom. How do we now assure people that they're going to be anonymous?
Right.
You can change your name and you can do all that kind of stuff, but how are you going to convince people it's okay? You can be open, and like you said about the hugs, and it's different than group therapy. You're not allowed to have hugs, and you can't hug your therapist.
Correct.
But this is where you go for the team, sort of like the comfort in your own people, and so that I'm really missing. I'm missing that connection, that human connection.
It's the human connection. Even going for a cup of coffee after a meeting together, you can't do it.
You can't do it. And the phone isn't, if you're struggling, like I know when I was new early on, I don't even really like to talk on the phone now, which is interesting because I am in an outreach position. I need to make phone calls. But it's hard. The phone weighs 1,000 pounds when you have to call to actually ask someone for help is completely different than just saying, hey, how's your day? So I think that whole experience of getting used to making phone calls in general. And, I had a few people that were new prior to this happening that said, hey, can you help me? And I'm absolutely. They want no part in these Zoom meetings. We'll connect after the pandemic is over. And I'm thinking, oh.
Wow. But, if your recovery is strong, God bless you. But what if something's happening? What if there's a stressor that you didn't count on happening? Who's going to support you right now? And that's what I get scared about, folks.
Because people are relapsing. I mean, people are relapsing. People are not, this is not just like an earthquake hit. This is a pandemic, which people don't know. I would say in general, people don't know how to handle it. I mean, we're all learning on the fly.
We are,
Everybody is, whether you're a doctor or a salesperson, we're all learning how to figure it out. And it's a scary time.
Yeah, we're winging it, basically, all of us.
Pretty much everybody's winging it. There's no book.
And that's where, I'm thinking, okay, here we are, we're relatively strong and maintaining stuff and all that. Not as vulnerable. Some folks are very vulnerable. And now, again, that I don't want to call it a parachute, but that support network it's different. If it's there, I'm thinking, okay, here we are in Massachusetts. We're relatively well connected, internet-wise, bandwidth-wise, all that good stuff, technologically speaking.
Yeah.
What about people out in rural parts of the country where there's no telephone towers to connect to? Can they get into a Zoom meeting? Can they do something else to keep themselves going and support themselves?
That's such an interesting thing. It brings me back to thinking about when the Alcoholics Anonymous big book was written. It's a textbook, when it was written way back, people were sending, the sort of corporate office for AA was sending out letters if someone was in the middle of nowhere. And I mean, to me, that's sort of unimaginable that the way they got sober was writing a letter, sending it in. And I know it sounds like so foreign, but it can work, is what I say. It can work, even if there's not the technology. But I do feel we're very blessed. If you're going to get struck with a pandemic, we're blessed because we have that. But, I would guess that people who are out in the middle of nowhere, if they have a spiritual foundation, which I hope they do, then you can get through anything. And I think that's what the pandemic is teaching me. You can get through anything with that spiritual connection. And that's what hopefully people get by getting involved in a 12-step recovery program, they
Right.
get connected to a higher power and they realize they're never alone anyway. And
Right.
if they are frightened, or they can always turn back to that. Now, I mean, that's sort of what I think. Well, if you're in the middle of nowhere, at least you have your higher power.
Right. I totally agree with you. What gets disturbing at times, you see it in the news, is some pastors are opening up their churches against the advice of health professionals, saying it's dangerous. Okay, that's one thing. So we know in the pandemic, the elderly are at risk, folks with certain medical conditions, whether it's asthma, diabetes, stuff like that. And again, our most vulnerable population at times, we know, are the folks who are in early recovery, and they may have all kinds of medical issues going on, uh, let alone substance use disorder. And now, okay, their spirituality piece, maybe they were going to church or whatever.
Right.
That church is closed. Does the church have capabilities as we are right now, talking to each other live, or is that taken away? So I do understand people's emotions of need for spirituality, but it's probably more of a need for, as you said, social interaction, the humanist piece of going to a church and then afterwards talking with people over a cup of coffee and some donuts or whatever. And again, that's gone too.
Right.
So, and again, for our vulnerable population that we treat, I go, wow. I have no other word, but wow. What
Wow.
happens?
Right, because it's easy for someone like yourself who's trained in the industry to see the anxiety level or the depression. Like, it's easy for you to see it, and it's different to treat it with something that you can't really explain, like what they're missing. They're brand new to this,
Right.
and you say, well, you don't really understand what you're missing, that there is coffee and donuts and someone there who feels exactly like you do.
Yeah.
Yeah,
I like that. I like that a lot that you said that.
you
I
can't
think,
really identify it as, you can't really train that. That's just something that comes with experience.
yeah,
And I think that's the hard part, to say, oh, in a couple months, you'll feel so different, but you will.
you
Yeah,
will. We
but you
all will. That's true. And as with everything, this too shall pass. This too shall pass. We know that. Right now is how can we help, and for hopefully the audience watching, and then this will get podcasted as well, so they can rewatch it. Is what else can we offer? What else can we suggest? Advise folks, guide them to keep them supported, feeling supported, that they're not alone. The peer recovery centers are closed, as you know.
Yes.
As well. Spectrum runs a few of them in the state, and others are probably closed as well. And again, that's another one of those expected venues where people went to hang out, to talk to each other, to maybe build a resume, shoot off something for a job, attend a meeting there at the same time, or just sit around and chit chat in a safe place. Now they're at home.
Right.
And hopefully home is safe. We hope.
Right. Yeah, hopefully.
Hopefully. And hopefully they have access to this kind of media that they can at least connect that way. But now I'm going, okay, yes, this kind of media is great, and I'm glad we have it. What else is there for folks to do? What I'm seeing on the media, because now people are spending more time on media, obviously, than more before, because you're at home.
Right. Yeah.
We've seen there's an uptick. I don't know if you saw some of this. First of all, we saw an uptick certainly of alcohol purchases of 243% in the past, I believe, month or so.
Yep.
And incredible, because yes, people are at home. They're bored.
They're self-medicating.
They're self-medicating because they're frightened.
If I were not a sober woman, I know for a fact it'd be like, it's a good reason. Why not? Let's just have some fun. We're sitting around anyway. I mean, but you can just, like you said, this is a social media. And if you just look at even Instagram or some various, people are really making huge jokes about day drinking. Like, who cares? We'll day drink. And I'm thinking, it's funny potentially, but it's a very serious issue.
Well, especially for somebody in early recovery, they're not as strong yet.
Exactly. And
Yeah,
they will succumb to that sort of romancing the drink. Like,
yep.
does sound good, but and they haven't learned enough about the disease maybe
Right.
to know that they have an allergy, and if they start, it's all, then they're back.
It's all over again, right? It's starting from ground zero. And yet you see also these, because I do understand businesses are closed, bars are closed, restaurants are closed. They're trying to make money. So they started take out alcohol, for instance, as a service, because they need to make money to pay their own rents and payrolls and stuff. But other things have opened up where, and it's again, people are looking at it, they're joining it. Bar chat rooms. So you're drinking at home by yourself, chatting with other people online,
Oh yes, I've seen
and drinking.
happy hour.
Happy
together.
hours, virtual happy hours, and going, good God, okay, I get it. People are trying to occupy themselves, but again, uh, isn't it easier then to be tempted and triggered because you're in the safety of your own home and you're not walking down the street and people in front of you on the screen are drinking? Easy to drink now for yourself as well. You're not going to be falling over somewhere in the
Right,
street.
and you're not going to sit there and have a Coke or a bottle of water. I mean, that's hard enough in a live situation when you're newly sober. However, that would beg me to say, if I was helping someone who was new, oftentimes you say you don't have to change much, just everything, just everything about your life. So it's like, you don't have to, or oftentimes you say, it's going to take a while. You might have to not continue to hang around with the same people you always hang around with, because those are the people that trigger your drinking. You might have to stop following a lot of people on Instagram or Facebook, because those people are drinking focused.
Yep.
And, but I know for myself, same. I mean, it doesn't matter that I've been sober a long time. I look at things and I think, well, that does look kind of fun. So it's like, I can't follow those people, because they romance it in a way that it's just too appealing. And it's like, that's never going to be that for me. I'm not going to be the lady sitting there with a fine glass, having a nice glass. That wouldn't be me.
Mm-hmm.
I would be the one going and begging them to open the bar. And so, so it's kind of like, that's another thing. You have to sort of maybe change your approach to social media. And there's tons of wonderful sober groups on sober, NA groups, all sorts of drug-free, alcohol-free, that are really, really quite entertaining, that you can realize, particularly if you're new, because you probably are thinking, I'm never going to have fun again as long as I live, but you will. And so if you follow some of those or do podcasts, it's actually such an amazing community. That's a good way to build a community. And I understand what you're saying. There's different ages. Like, would a 60-year-old person getting sober all of a sudden want to get onto I don't know, but I'm sure there are things for that age group as well, versus a 20-year-old.
Right. Because my fear would be, because we have the other side too, where I'm sure folks are chit-chatting, even let's say 60-year-olds online, whether through Twitter, whether through Instagram, Facebook, or just messaging each other and lamenting this crisis and that they're fearful of things. I'm imagining, if you're a sponsor, you might be being inundated right now with folks, your sponsees, so to speak. And I'm wondering, wow, that's a whole different ballgame. It's a thing called, in the field of treatment, especially in substance use, compassion fatigue, which means it's not quite burnout, but it's also where you're getting exhausted yourself from giving during a crisis that you're in yourself. And it's an interesting concept right now with COVID-19 that not only sponsors, I'm sure some are suffering from compassion fatigue, treatment providers are, meaning clinicians and stuff like that. We certainly know hospitals are, and personnel.
Yeah.
So I'm now going back to folks who might be recovery coaches out there. Are they still going into neighborhoods with masks and stuff? Are they getting inundated? So I also get concerned. I have a lot of concern for everybody right now.
No, those are really interesting concerns. I almost think you just described it. I think I have compassion fatigue, because I want to help everybody. It's sort of like you just described me. It's like, there's a lot. Well, and I actually think working from home has, in a different way, because I'm not spending time driving, I'm not spending time, I think in a way it's a freed me up for more time to have more compassion. It's like, oh my goodness. Yeah. I think there's a lot to that.
And so now herein lies then the question, for instance, are others, whether people who are sponsors, longtime sponsors and all that, are they taking care of themselves too, to combat the compassion fatigue too, meaning care for yourself too? Do something more fun and all that. Don't just put everything out there, because it will drain you during this time period.
Yeah. No, yeah, that is a good question. Yeah.
So these are all things around, this pandemic. And that's why I thought you'd be a brilliant guest here to talk about stuff, because you've seen stuff, because you're out, as you said, traveling for Spectrum, talking about treatment, what we provide for folks and stuff like that. And that's why I thought, okay, wouldn't it be nice to talk about COVID-19 in the realm of how are folks faring overall? Meaning folks in recovery, early recovery, late recovery. Though I'm wondering here as well, those who are contemplating recovery, not there yet.
You know what? I totally agree. If you're contemplating, I would say now's the greatest time, right?
Yep.
What are we doing? Because if you're an alcoholic or an addict, typically you would probably be getting worse right now, because your quantity and amount of time you have to spend is just there. You're not functioning like a typical day.
Right.
No one is.
No one is.
So I would say now's the perfect time, and because then you could come out of this. Let's hope it ends soon, because we're all feeling just out of our minds from just being home, probably.
Yeah.
And God forbid you happen to be in a relationship that's uncomfortable. I happen to love my husband, so no problem there. But like, imagine if you were going through a stressful time in your relationship. That's hard too. I guess I'd say now's a perfect time to get sober, because you have the time. It frees everyone's mind up, so you're not bogging down the family with worry over you. You'll be someplace safe, so they can be someplace safe.
Right.
And I think, and I've talked to multiple people during this time who need it. And I'm like, oh, it's perfect. Now is the perfect time. You can come out of this healthy.
So from your professional perspective now, because you reach out to folks and all of that saying, hey, here's New England Recovery Center, here's Spectrum Health Systems.
Yeah.
Is it something that they need to worry about finding a place to go, a bed, as they say?
Yes, because not every place is open in full. We happen to be very fortunate that we're doing well. We have beds, and it's frightening if you're a mother, you don't want to leave your kids, if you're, so there's different things for different people. But we at Spectrum and New England Recovery Center, thankfully, we have all the right setup so that we can, pre-screen people. We're not putting sick people in with healthy people. Like, we have the perfect system, and I can't speak for other places, but I know beds are not always easy to come by. Right. And we happen to cover the gamut from public health to commercial insurance, that wherever you are in the spectrum, we can help you, be it also alcoholism, drug addiction and substance use disorder, like any of it. And I think, that's one of the reasons I think now is the perfect time, because the beds are there. It's almost like special attention will be paid to you. Because you're at a time when, there's extra TLC coming your way, because these are tough times for everyone.
Yeah, no, I thank you for saying that, because I'm sure there are folks, maybe some of our listeners or folks that they love and care about, who are contemplating needing help and maybe scared of going and getting help right now. Here's another thing I'm thinking, and please share your thoughts, is that I wonder if there are folks who are contemplating help for their addiction, substance use or whatever, but at the same token, they're feeling guilty about going and getting help, where other people are dying of, let's say, COVID or things associated with COVID, contracting COVID. So I'm wondering if there are folks out there. What do you think?
You know what? I, as a recovering person, I would say when you're contemplating, you're so selfish that you're probably not thinking that way, but maybe there's the handful. But I would say also something you touched on before is you sort of have to fill your cup up before you can give to others. Like put on your own oxygen mask or you can't help others. So really, if you're in the middle of an active addiction, you're not really capable of helping anyone anyway.
Right.
So this is the perfect time to get yourself in a position. In fact, I know a few people that, one's a nurse and she's like, I want to be able to get well so that I can do my job as a nurse, but I want to be able to give back to this population that's helping me. So, so the learning about recovery and staying in recovery helps also, because then you can't really give that back unless you know it yourself as well.
True. Very true. And as you mentioned that you're in long-term recovery now yourself, having said that, it's up to you if you feel comfortable sharing, knowing what you know now, to share with folks who are in early recovery and probably scared right now. What could you share to keep them going right now?
Oh, my goodness.
I didn't mean to put it out like that.
That's a good question, but I know without a doubt, like this is the one thing I do know, is that there's hope. Like if you stop using the substances, it's going to be difficult, but it will be the most rewarding thing ever. It's the best thing I've ever done in my life, ever. And
I don't think I've been doing this for a long time. I haven't heard that kind of phrasing. I think it's marvelous that you will be rewarded.
1,000%. When I talk to people who are new, I always say, if you can just, I can always run out and go to the package store. There's one, 100, it's very close to me. I live right across the street from one. I could run out and drink, but when I was newly sober, I said to myself, I can always drink again, but I may never be able to get sober again.
Wow.
And for me, that was a big thing. Like, I deserve it to give myself a shot at it. I don't know what's going to happen, but who knows? And, it wasn't like any big white light came down and saved me. I had to do the work. And my life was just sort of not going anywhere. I had a great job. I had great friends, or I thought, but my life was very small. And it consisted of coming home at night at the end of the day, pull the shades, open some wine. And, if drugs were there, that was fun too. But what was really happening? Nothing. I had a cat and that was about it. People always laugh and say, oh, that cat. And I was like, okay, and then I thought I'd give myself a shot at it. If in a year or 3 months or whatever, this isn't making my life any better, I can pick up a drink. I mean, the drink is still out there. But amazingly, my life, it pretty rapidly turned around. I was the type of person that when I would fall asleep at night and, I had an alarm that you could hear tick, 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 and I could hear the clock ticking. And I would think to myself, how am I going to pay my bills? How am I going to do this? How am I going to, and in very short order, those worries lifted from me. It was as if the drinking was causing it versus... Wow. I thought it was my solution, but really my anxiety and fears just started. I could sleep, and all of that wasn't gnawing away at me in my head.
Wow. Okay. So again, I think that's, those two phrases that you just shared, I think it's just wonderful for folks to hear, because as as we all know, the reward for drinking was just basically, like you said, to make things go away, numb stuff up, whatever. The wonderful effects weren't there after a while.
Exactly.
But to become sober, maintain sobriety, your recovery is rewarding beyond all belief.
Best thing I've ever done. It still is.
Wow.
Yeah.
Aside from marrying your husband.
Aside from marrying my husband, yes.
Right. Just want to point that out.
Well, no, he would probably even agree. Me getting sober was the best thing I ever did. He would buy into that as well.
I like that so much. So let's shift gears a little bit. Would you mind talking about how you got to where you are?
No, I don't mind at all. How I got to where I am today, or how I got into recovery in general?
Well, in recovery, we can synopsize it to how you got to recovery, and now here you are helping get people into recovery.
You know what? Nope, I don't mind talking about that at all. Well, what got me into recovery initially, I was saying, pull the shades, have wine. Nothing was really amazingly happening in my life. And I had a therapist who was treating me for depression, which I thought was my self-diagnosis was, I was depressed. In reality, I'm sure it was all the alcohol in that. And he suggested that I try a 12-step recovery to try and see if it is alcohol or drugs that are causing it. And so I got into 12-step by just sort of a friend of the therapist actually brought me to a meeting and talked to me about what it was all about. So that was years ago. And then I was in a sales position for many years selling paper. And it was a declining market. And I thought, how am I going to reinvent myself? What can I possibly do to stay in what can I possibly do to stay in sales that I would be passionate about? And the one thing that I knew I was passionate about is recovery and helping others. So there happened to be a lot. It was about 4.5, 5 years ago when people were getting much more aware of the treatment industry. And I thought, that's it. This is what I'm going to do. And I got into a couple different places that I didn't love because I didn't feel as good about the treatment ethically as I would like to. That's sort of when the Florida model became national news. And so now I love working for Spectrum and New England Recovery Center because I can help all levels of people, all types of insurance or no insurance. And to me, that I really, every night I feel like now I'm helping people.
Yeah.
That's how I feel. Yeah. So that's what got me from there to here. And, paper, it was fun and it was a great business, but it's nothing compared to actually feeling like I'm touching lives.
And based on, I've known you now for a little bit since you started with us, you are, I think, which is why I'm so happy you were able to join us today. Because again, yes, you are getting notoriety in a good way.
Thank you. Yeah.
And I think
it's all because I'm passionate about my recovery too. Yeah.
And it shows. It truly shows. And I think during this time of a pandemic, somebody saying the passion of my recovery is a very powerful thing to say for folks, so they don't lose that focus on recovery. That passion is still there, because we're hearing, as you know, we all know, we're hearing lots of bad things out there happening and scary things happening, and truly a fear of what's going to happen next kind of thing. And so that takes me back, and perhaps now, and please chime in, that I wonder if a lot of folks, again, let's say those who are learning about recovery and establishing themselves in recovery, fearing what's next, what's waiting for me down the pike. And that's a normal thing many times for folks without a pandemic happening. And yet now with this on top of you, all the more reason that my mind goes immediately back to some of the old time AA sayings of one day at a time.
Totally.
And so please chime in. Am I off on saying that?
No, definitely.
Focus on one day at a time right now.
Totally. One day at a time right now is all really, I need to get myself into one day at a time constantly. Or my husband's favorite one is first things first.
Yep.
He's in another program. He's not in, he's in a support program to sort of help me and take care of himself because he's married to me. But first things first is really one that we sort of live by, is because it's so easy to get way out of the moment and out of the day. And, living in the day. Yeah, totally. Living in the day
is so. You don't need a pandemic to forget and lose focus. And yet here we are, And that's where I thought I wanted your opinion, your input on something like that. Do you think folks are looking what's going to happen next? Oh my God, what's the next level of death occurring or something like that?
Well, yeah. And, for me personally, I think about, I have two elderly parents who live in Connecticut, and my mind can go to, what if they get sick? What if they get this? And I can't go hold their hand on their deathbed, blah, blah, blah. And then I'm like, well, okay. And I have to bring myself back. Okay, where are they right now? Oh, they're at home. They're fine. They're not sick. They have food in the refrigerator. They have the bills paid. So it's like really bringing it back. That I can't let myself get that far out of today, because otherwise it's like, okay, then I should just drink. And it's like, no, 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 no one's sick. What am it's not like, however, there are a lot of people that are suffering that potentially are alcoholics that are losing loved ones. And what I would say to them is, you know what, you're honoring your loved one by staying sober. You're honoring them, and you're able to actually be in the present. So 5 years from now or a year from now, you're not going to talk about how you weren't there for them, because that's all a loved one would want from us, is to stay sober and be present for them, even if you're not physically in the space. That's what we want. And then, they don't need to die in vain so much as with regrets, or you don't need to regret the way they died, because you did everything you could by being a sober male or female. You're showing up for life, as hard as it is.
You were there in the moment.
Yep.
Okay, thank you for sharing that, because again, and I'm hoping our audience is kind of gleaning some of that stuff for those who need some extra strength, because what you just said caps it, meaning keep your sobriety first things first, keep that, because otherwise nothing else will matter.
Correct. When people start going, what if I never get my job back? Or never, okay, well, guess what? If you keep drinking, you might not have a job. So don't worry. It's like, first things first, you must deal with the thing that's first on your plate, which is staying away from a drink. Everything I have found over the years, if you stay away from a drink and a drug, everything falls into place.
I think that's, again, a brilliant way of saying it. And it's fate. Things are meant to happen that way.
Yep.
But if at least you are guiding your own fate. I do feel for the person. I did see, a person wearing a mask, and then under the mask, they put a bottle, so I'm going, okay.
And I have compassion for that person too, because they need it. They need it. They're not aware that their disease is calling the shots right now.
They're not aware, and they're probably just frightened as well.
Fear. I've heard that it is fear drives us. And that's why, if we could stay away from the fear, that, like I said, the story about my parents, it's like, it's all fear based. And I can't let myself go there, because fear is not good for me, or addicts in general. It's not good. It drives us to do things we wouldn't otherwise do.
Right. And in this case, fear, if it's warranted, then it's legitimate. Meaning, if your parents, let's say, or somebody else's parents during this pandemic, and you're in recovery yourself, or not, doesn't matter, who cares, that your parents are safe, they're healthy, then fear is not warranted, because, as you just said, fear will be your undoing.
Right.
If their life was in jeopardy, meaning of losing their life or being threatened right now, then fear is legitimate, and that's okay to fear sometimes.
Correct. But then I would say it's legitimate fear. But then when you get to that moment where fear is real, you'll be given the strength to get through it.
Yes. Okay, I like that.
Differently than, having fear. And it's like, oh, okay, now that's my reason. I feel like if it comes up, then I'll handle it, and I'll be given the strength to handle it.
Perfect. And that's the thing that I hope folks are getting, that to be afraid of whatever's going on right now, the pandemic. If it's threatening you right now, then yes, act on that fear, take care of yourself.
Correct.
But don't let the fear become part of you, make you up. Meaning, you're okay, you're safe, you're doing the right thing, you're maintaining sobriety, you're putting on a mask, putting on gloves when you have to go out, doing the social distancing stuff, and doing everything you can to maintain your self-support, meaning whether virtually or somehow, then don't fear. Don't
Right.
let that fear become part of you.
Right. It's like turning the unfounded fear into something that's real when it really isn't.
Well, it really isn't. And again, and that fear, as you said, might unfortunately, God forbid, cause a relapse to occur.
Right. Yep.
Because
Hopefully that's not necessary. Something I've often heard too in the halls is feelings aren't facts.
right.
So
They are not.
you can be afraid, but that doesn't mean it's real.
That's right.
Or you
It's just a
feel it.
response to a real or not real, but it's a response.
Yeah.
So as we start winding down, what could you give the audience as a sort of a takeaway? I always ask guests of this as we start wrapping up. What could you tell the audience during this time period of whatever comes to your mind, free floater right now, to help them along? We talked about a lot of good things. What would you encapsulate it as? It coed be a one phrase or it doesn't matter.
Well, I think the first thing that comes to mind is there's hope. Like
Perfect.
there's totally hope there,
Perfect.
and don't let the fear keep you from grabbing onto the hope.
Yep.
Because even the fear of getting sober or putting down drugs, that's real too. But there's hope there, and there are people there that will help you. You're never alone, ever.
Perfect. And certainly they can turn to you, I hope, or somebody
Absolutely.
else. Call up New England Recovery, call up Spectrum, doesn't matter, or somebody,
We'll
doesn't
help.
matter.
If we're not the right place, we'll help you find the right place. But there are beds, and if starting, not everyone needs a detox. Not everyone needs to start at a treatment facility. I didn't. But that doesn't mean you can't make that phone call and talk to someone. You can talk to me, talk to you. I mean, there's people there that we can talk to.
Sure.
So I think that's the premise. Like, don't be afraid to make that call because there's help there. There's help.
Perfect. So again, Catherine, thank you so much for joining us. And hopefully maybe in the future, come back on again, maybe in live, I don't know.
Yeah, thank you so much. I look forward to seeing you soon too.
Thank you, and take care of yourself as well, okay?
Thank you. I will. You as well.
And thank you to the audience for watching us. Hopefully, if we're able, we'll be live in person next time. If not, we'll do this again and continue on. So thanks for joining Airing Addictions. I'm your host, Dr. Romas Buivydas. See you next time. Stay safe, everybody, and healthy.